Hey guys, welcome back to Medical Coding with Blue. It's been a while since I've done a modifiers video, so I'm going to talk about modifier 58 today. But before I begin, I need to make sure that I preface this whole video with this message first. Modifier 58 is a complicated modifier, okay? Now, I do not work on the billing side of the house. All I do at work is medical code. I just work with the charts. Somebody else takes care of the billing, and that's the way I like it. Insurance companies are very particular. Some of them are very particular about how they do things. The particularity of each of these insurance companies can vary from state to state. So, I will say this. What I am presenting today is my own research about modifier 58. This comes from the CPT manual. This comes from a coding clinic that I will include down in the description box, or at least the location of the coding clinic, because I don't have like a link. And some other websites, which I will send you the link for those websites that I used. There's not a whole lot of information. Now, on the Medicare Learning Network, it does briefly talk about modifier 58. It doesn't really go into it too much, I think. Okay, so I could be wrong, all right? But this is what I have come across. Now, I'm not going to debate insurance companies. I'm not debating insurance practices, period, because I don't work with the insurance companies. So please don't ask and please don't say because I don't know anything when it comes to dealing with the insurance. Okay, somebody else takes care of that. We're going to go ahead and get started. Okay, what is modifier 58? Let's start with that. It is a staged or related procedure or service by the same physician during the post-operative period. It helps in the reporting of procedures occurring as a result of any one of the three circumstances: those that are planned prospectively at the time of the original procedure or staged, right? Those that are more extensive than the original procedure, and those that are for therapy following a diagnostic surgical procedure. Now, the wording on that last one may have changed. I think I heard that, but I'm not really sure. So I'm just throwing that one in there, okay? Just because it was there, all right? This is different. Modifier 58 is different from modifier 78, which is an unplanned return to the operating or procedure room by the same physician during the initial procedure, following the initial procedure, for a related procedure during the post-operative period. This usually happens if there is a complication of the surgery, okay? That's when you would put a 78 modifier on the procedure, okay? But I just wanted to make sure that that was clear, okay? Now, number 2. According to the CPT manual, it is not necessary to meet all of the following to qualify for the use of modifier 58. It can be any of the following. It was planned or anticipated, staged, right? Was more extensive than the original procedure, was performed for therapy following a surgical procedure, or was performed during the post-operative period associated with the original surgery. Okay, so I'm going to give an example in a little bit about that. Documentation requirements. The provider should always have the procedure that was performed somewhere documented in the note, as well as the date of surgery, so that the coder knows what kind of procedure and global period we are looking at, as well as the ability to accurately calculate the post-operative days. I stress this all the time. In the beginning, before I really started digging in, I saw my provider say patient is post-op day 20 and wouldn't tell me what procedure it was. So how was I supposed to know if this was for an injury surgery, or if this was, for a neurological surgery, or if it was for a musculoskeletal? What was it for? Okay. And not only that, they may say yes, they're 20 days post-op, but is the count being accurately done? Okay. So you know, they have, it has to go in a certain way when you're counting the days. So this is why I tell them, just give me the date of surgery and what surgery was performed. Just tell me the name of the surgery in like the HPI and the date that it was performed, because that way I'm able to have all of the information there. Because in the outpatient setting, now I'm only talking about the outpatient setting, okay? In the outpatient setting, every encounter note stands alone. That means you cannot refer back to 5 days prior if they had an appointment 5 days ago, and you can't go and look and see what information they have on there to help you out with this encounter note. No. Everything that is in that note is what you're coding with, okay? So this is why I tell them that information needs to be carried forward on there, so that way I know where we are in the post-op. And I know when we are out of the post-op, because a lot of times my providers would get sort of confused, like, okay, what happens now if they're out of this global period? There is like 100 days ago, and I'm just checking on them and they're fine. What do we do? That's when you use the Z09, the follow-up, and then the history of whatever code it is, like if it was for an injury or from, you know, some other specified thing. There's a whole list of those. So this is why I tell them, make sure you tell me so that way I know, and I know which aftercare, or if they're already out, I know what to do from there. Very, very important that they document all this stuff, all right? Now, next thing is, different insurance companies will have different policies when it comes to Modifier 58. My goal is to pass along when it is properly applied. Please consult with the insurance company for further clarification. If you are getting denials, submit your supporting evidence. Sometimes these things are a matter of clearing up a misunderstanding, because the billing with the insurance or whatever, it can be wrong too, okay? Everybody's human. We all make mistakes. So it could be a misunderstanding from either them or from the coding. It depends. This is why you have to follow the rules, and you have to try to understand as much as you can. And with this Modifier 58, it's a little tricky. If you look it up online, you'll find a lot of different things. And if you don't really know what you're looking for, it can get overwhelming. This is why I've sort of taken the legwork out of it for you. And I'm going to give you guys the links that I used for this. Okay, so I said this is, like I said, this is why following the rules is very, very important. All right, the next thing is examples of when to use Modifier 58. A good way to think about it is if the provider knows that they're going to perform this service before the end of the original procedure. Using the example for orthopedics, a lot of times the ortho surgeons will go in and they'll say, we're going to do a reduction of this fracture. The patient will follow up in 6 weeks for a recasting or whatever, pins or whatever, if they have to remove them or whatever. They'll follow up in 6 weeks, okay? But for that initial closed reduction or closed treatment or whatever, you're going to use the appropriate procedure code, okay? And then on those subsequent visits, we know that the provider already planned to do that recasting. That's when you would use Modifier 58 on the recasting. So, all right. Replacing a cast on subsequent visits. And then a surgeon who performed a biopsy on a patient gets a pathology back that's positive and has to go take the patient back to perform the removal. That's another instance when you would use Modifier 58. So the first time that they do the biopsy, just say, for example, they take a breast biopsy, right? If they do the excisional breast biopsy, that's a 10-day global on that one. The pathology comes back that is positive for malignancy. The patient has to be taken back to the OR and it has to be removed. So when they take that out, that procedure for the removal of that mass, or whatever the malignancy, is going to have a 58 modifier appended to that procedure. because it is, we already knew that they were going to have to come back and get that out. Okay. And then finally, Modifier 58 indicates that this is a staged or related procedure in a global period. Okay. Staged or related. That is the underlying word right there. Staged or related. If the 58 modifier is not appended to the code for the definitive procedure, a third-party payer could reject the claim because the procedure occurred during the global period associated with the initial procedure. Please see CPT Assistant, and I'll list it down in the description box below. I've always thought of this 58 modifier as that signifier to the insurance company that they know that this is part of this global package. That's the way I've always thought about it, but there's apparently a huge debate going on about this. So I'm just going to leave it right there, and I'm going to let you all make your own judgment on that one, okay? I am just sharing an example of when a properly placed 58 modifier is going to happen, okay? A lot of times these modifiers are not explained very well anywhere, okay? So if you can find somebody that understands them or sort of gets how they go, it's a good thing to have them share with you their knowledge, right? Just a bit of my thoughts on that one. So, and I know I have the 33 modifier to work on. I've never worked with the 33 modifier, so I have to do a little bit more research on that one. But 58 was a discussion the last couple of days. This was a question from one of my coworkers. We were talking about this actually on Friday. And then, of course, it got brought up again this week. So, anyway, that's going to wrap up that part right there. But I did want to say thank you so much, guys. Because of y'all, we hit 2,000. So, I am so excited about that. I am very, very appreciative. I am so excited about the direction of this channel and all the good things that are going to come from this. I really, really appreciate it. Like I said, this is really, really nice to see that flip to the 2K. So, yay! So thank you, everybody. I really appreciate y'all. And I will go ahead and close this one up. So if you have any questions, please let me know. And I will be doing a Quiz Friday tomorrow. It will be an Evaluation and Management edition. Now, if you have a question about evaluation and management, please let me know, because I can incorporate those questions about evaluation and management into the quiz. Because right now I'm sort of breaking down, I'm going through this section of the CPT book so that I can formulate questions for you guys and sort of help you to think about ways of thinking about it. Okay? That's the best way to learn it, is if you start having to look at it one way and then sort of wrap your head around it another way. At least that's the way that helped me to learn it, if that makes sense. Anyway, I'll go ahead and wrap this one up. So, if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, I will see y'all on the next video. Bye!